Here's a quick checklist whether you should be taking the study on or not. First, you want to check out if you can recruit and retain the patients. Some of these studies out there, they're hard to recruit patients for. We definitely know Alzheimer's patients can be difficult and challenging to recruit for, but then there's other studies out there that have weird and unusual procedures that patients may not comply with, such as the length of the study or certain types of procedures. So you want to check in your patient database and make sure that you have sufficient amount of patients, whether that's for your research site or coming from your PI's private practice. So definitely survey those two areas. And then if you're going to rely only on promotion and advertising and outside third-party patient recruitment, those can be areas where you may want to be a little skeptical if you want to take the study on or not. And of course, then you want to also look at the types of resources you have available for this study. Do you have the staff? Do you have the PI who's experienced for this type of study, or are they only very superficially experienced in it? Do you have the type of equipment necessary for this study? Do you have all the other office space, and do you have the capacity and the bandwidth for this study? And then of course evaluate your chance of obtaining the study, because you'll be competing against hundreds of other research sites that are also going to be making a play for this study. So if it seems like you don't have the experience or the resources or the staff, there's no point of going through the feasibility analysis and spending your staff and your time completing it if you're not going to get the study. So remember that the sponsors and CROs will definitely get very nitty-gritty when it comes to the feasibility analysis, so that's where you could definitely save yourself quite a bit of time. And also evaluate if it meets your site's standards. You have to see if this is within your area of interest. Just don't take the study for the sake of taking the study. There's plenty of out there, and you can definitely gain many other studies out there. And also evaluate the study's budget. If it doesn't reimburse you for the study-related costs sufficiently, then don't take the study on. And if the study doesn't match the type of patients you have, definitely decline it. So again, don't waste your time and effort on studies that lead nowhere. And when you decline a study, make sure you do it very gracefully and let them know particularly why you're rejecting the study, and also keep yourself open for more studies down the line for the same therapeutic condition if that's what you're interested in, and just let them know this is a specific protocol you're not interested in. And again, before you decline a study, always look at the protocol. Don't ever preemptively decline a study. And again, coming back to the topic of feasibility questionnaires, make sure you evaluate if the study is worth doing, then do the feasibility questionnaire, because we all know how much time they take. And then again, give the sponsors and CROs some feedback about the study if you decline it. And when you're not sure, talk to your PI and your staff, and you'll find out if the study is right for your site or not. And here are a few other final checklist points. Really figure out what your site's therapeutic expertise is, and figure out what your PI's experience are, or if you're able to bring on new PIs for the studies that you want to recruit for. And then what sources do you have for accessing and recruiting patients? And what are your methods of retaining patients in this study? And then what are your desires in future studies and future therapeutic area expansion? And then also look into the fact that the study should be bringing out the best in your site, and not something that you're just trying to venture into. Because if you're trying to expand into new therapeutic areas, there's certain types of studies you can look into, such as phase 4 observational studies and a few of the easier protocol studies out there. And then also gauge if the sponsor CRO is going to have more of these type of studies in the future. And then also gauge if the CRO's area of expertise of this study as well. And then have they been awarded the study in the past, and how often? That does sum up our quick little guide into declining a study and a checklist for it. We hope it helps. If you have any other further questions, feel free to reach out to anyone at TrialJoin, and we'll help best answer the questions you have.